Hey guys, I'm Dr. Josh. Today's episode is going to be a little bit different, and today we are going to talk about some wrist pain, some pain that I've been having, some symptoms that I've been having, and this wrist pain has been as a result of Quervain syndrome, which is basically a tendonitis. So if you don't know much about that, I do have a couple videos and I will link them down below as well as over here so that you can learn a little bit about it. But it has been about 6 weeks. I've had treatment, I've had lasers, I've had anti-inflammatories, I've had a lot of pain into this area. As a matter of fact, it's worse on my left. I have it on both sides. It's very rare to have it on both sides, but it does happen because I am somebody who does a lot of muscle work and a lot of rehab, and I use my hands quite a bit with regard to treating patients. So, that being said, if you're somebody out there who's been dealing with wrist pain, it's been hard to grab, it's hard to do things, chances are you might be having some wrist pain. But not only am I going to show you some things or tell you some things that I've been dealing with, I have been doing anti-inflammatories, I've been doing bracing, I've been doing some Grassin treatment. I've had a lot of treatment and some modalities that have helped, and I've rested significantly. I haven't really lifted a lot of weights in the last 6, 7 weeks. I've been just running a lot. And yes, this one feels about 70 to 80% better as of 6, 7 weeks out. And this one feels about 90 to 95% better. So I feel pretty confident in this one. I do feel confident in that these both will heal, but I really do need to stop reducing the insults and to stop reducing the injury. So today I actually have a scheduled appointment with the hand surgeon, and it's not because I plan on getting surgery. It's because I plan on looking at what's going on to the structure of the hand. So probably take some x-rays, possibly get a cortisone injection, and of course we will document this stuff and show you what the procedures are like if we do need some of that stuff as well. But I'm thinking about getting the injection, which is a cortisone injection, not because of this pain, but because I think I'm getting a little bit of arthritis as a result of all my work in that area. And as a result, I can feel a little bit of a nerve hypersensitivity. So I think what they'll do is they'll end up doing some injection in this area right here. So I don't know if it's hard, if it's easy for you to see, but you can kind of see it's a little bit more bony over here, right? So right over here, but compared to this one, it's not as bony. And when I kind of strum my finger over there, it's a little bit hypersensitive to the nerves. So today's episode is going to be, like I said, a little bit different, more like a vlog-like situation. Going to show you what it looks like as well as some of the things that I experienced as a result of this cortisone injection. So stay tuned. Hopefully you enjoy it, and I will see you guys for the rest of this video. Today, I wanted to give you a quick little update about the orthopedic visit that I had where I had a cortisone injection. I only opted in to get just one injection. I did not want to get my right arm and my left arm, but I did get the left one because that was the one that was worse. It was about 75 to 80%. And now it's probably about 90%, 95%, whereas the other right one is about 90, 95% as well. So it really, really did help. And I felt some pain relief within, maybe, sometimes 30, 40 minutes. I thought I felt some pain relief. And then even then, I felt like it continued to get better. So even though I got the injection and I feel a lot better, I'm still doing the right protocols. I'm still bracing it. I am still making sure that I'm taking care of it and I'm not overusing it. So I decided only on one shot because I didn't want too much to go into my body. I'm a minimalist when it comes to that stuff. I don't want to take more medications or things that I want or need. So I wanted to just update you. I found it extremely valuable. I was a little sore near the injection site. I still am, but there's also a lot of pain relief as a result of that. So, if you're somebody who's been suffering a good amount of decurvains for quite some time, like myself, 6, 7 weeks, it's really not going away. This might be another last licks option, especially if treatment is not working for you. Again, the cost of what this type of visit might cost depending on who does it for you and all that other stuff might be just as expensive, if not more expensive, than getting treatment or vice versa. So it depends on who you go to, what you're doing, and things like that. So I can't necessarily speak all the time about costs because every provider is different. Insurances are different. I tend to pay cash for everything. So, I end up getting cash discounts because, I pay cash for it. But I wanted to give you a heads up. I feel much better in my hand here. I tried to record it again. I'm sorry I could not get it for you guys, but I just wanted to give you a little update, let you know what happened with the injection. It feels a lot better, and I could see how people would want to go back to doing this because it is valuable. But you can't get too many steroid injections in a joint or an area because it can cause future problems. So something to note. So if you have to get it, get it. If you don't need to get it and you can ward it off for a little bit, it's probably a good idea to do that. But I wanted to give you a quick heads up on this, and also make sure you subscribe to our channel if you found this helpful or if you found some of our videos helpful. Thanks again. I'll see you guys soon. Bye.